This year, more people will lose their sight and become legally blind from the effects of diabetes than will fill Arco Arena for a single Kings game. In the United States, there are 16 million diabetics, and 1 in 4 of them have some form of diabetic eye disease.
Dr. Brent Reed from Griffin and Reed Eyecare joins us now with more. And Doctor, it's good to see you today.
Thank you, Jonathan. Good to be here.
It's very odd. It's something that I didn't realize, but I mean the normal things that people can suffer from as far as your eye degeneration goes with glaucoma and that type of thing affects diabetics, but also there is particular problems that diabetics have.
They do have particular problems. In fact, one of the things that they suffer from most is a lack of knowledge that they may be losing their sight in the early phases of diabetic eye disease. Strong family history is something people should pay attention to. History of increase in thirst and or urination or frequency of urination is something they should pay attention to very carefully. Sometimes when people gain a few extra pounds, just as little as 20 to 25 pounds being overweight can tip you over into being a diabetic. The effects on the eye don't occur immediately. They occur down the road. They occur as time goes by, but they're devastating when they're unchecked.
What's the connection? Why does diabetes cause the problems in the eye?
What happens, Dan, is that the eye uses an incredible amount of blood supply, nutrients from the bloodstream. For everything you see, there's a chemical reaction occurring, taking nutrients from the bloodstream. Those blood vessels are critical to a good functioning retina and good vision. Diabetic eye disease really involves a lack of vessels strength and continuity so that they begin to leak. This is a picture, actually, one of the things that also is caused by diabetes, which is an early onset cataract. Cataracts actually come on much quicker in patients who have diabetes than other folks, and I think we have some other graphics too coming up. This is a picture of what it looks like when those vessels that are in the back of the eye become incompetent and leak. On the right, you can actually see some of the leaking blood vessels with the hemorrhages. They actually leak some of the proteins out. It looks like that yellow matter that you see around there as well. And then this is a picture of what happens when the vessels actually go beyond that. The eye tries to grow new blood vessels to make up for the lack of the ones that it needs. And those vessels are very incompetent. They break, they bleed. Sometimes we can laser those vessels, and that's a picture of some laser spots there on the right in the back of a diabetic eye that have stopped that leakage and prevented those vessels from deteriorating further. That's the key to success with diabetes. Catch it early, treat it aggressively, and you can save sight. I've never seen a diabetic yet in all my years of practice who's lost their sight that did a good job of coming in and being checked regularly.
What is the key then to having it found early?
Well, if you have a family history, or if you have any of those symptoms that we talked about earlier, you should go in and get checked. Sometimes something as little as fluctuating vision during the day. Blood sugar goes up, people become more nearsighted, their distance vision drops. If you're seeing some of those symptoms, or if you haven't had a good eye exam and you have some of this history, get checked. Make sure that you're okay. If so, if the eye doctor sees something they're concerned about, they'll send you to your internist for a fasting blood sugar, and then you can go from there and be taken well care of.
Now, you talked about using the laser to do some repairs. What about using laser to correct vision in diabetics? Is that something you can do?
It actually works fine. I saw a gentleman last week who's a diabetic, been a diabetic for 15 years, has none of that vessel disease in the back of his eye, and his sugar's under good control, and under those circumstances, he can have laser vision correction.
All right, now as you're talking about the blood vessels, growing new blood vessels, leaking and causing the problems, but also you mentioned the cataract and glaucoma. And is that more prevalent then in diabetes?
It is. You see a higher incidence of cataracts among younger patients who are diabetic. The cataracts tend to come on earlier, and there is a link between the gene for diabetes and the gene for glaucoma. More diabetics have glaucoma as a percentage than the general population.
You look sharp,
Thank you, Dan.
We'll see you next time.
Thanks a lot.
Jonathan.